Health leaders issue a warning about a possible triple-demic that could unfold this winter. Thanks for choosing News Channel 11 at 5. I'm Sarah Diamond.
And I'm Josh Smith. Cases of influenza, COVID-19, and RSV are all expected to increase. Respiratory illnesses are spiking around the country, and our region's no exception.
News Channel 11's John Janko talked with local medical experts today who say that we need to use some common sense precautions, and that could help keep families healthy and keep hospitals from becoming overwhelmed. John?
Yeah, Josh, Sarah, Ballad Health's top pediatric officials say surge plans have been prepared for emergency and pediatric departments at area hospitals. In the pediatric wing, RSV, a high concern. They've seen a large spike in cases from last year already and say this year's RSV strain has been more severe.
We're seeing more children having to be admitted to the intensive care unit and for a longer duration.
RSV on the rise nationwide by 200 to 300% from last year. Ballad Health says it's seeing that same pattern locally. With flu season off to a strong and early start and COVID expected to rise this winter, preparations are already underway for a triple-demic.
We really spent this week reviewing the surge plans, updating those surge plans, and talking about really when it is time to implement.
No surge plan in place now, but Ballad's still dealing with a nursing shortage heading into the season. A surge would likely require moving around patients and resources.
All hands on deck, all hands approach. We're looking at some different care models.
This respiratory illness season much different than the last two. Much of the COVID mitigation is now gone, and it's changed the outlook this year.
We definitely have a good chance to see COVID-19, RSV, and flu throughout the duration of the winter and early into the spring.
Symptoms between RSV, flu, and COVID overlap, including coughing, shortness of breath, and a runny nose. Ballad offers a rapid test that covers all three, including 2 strains of the flu.
It's difficult to know without a test which one you're actually experiencing.
Preventing infection starts with the typical hand washing, proper covering of coughs, and staying home when sick. That's especially important with RSV.
If you have a child that's in school that may be having any signs of respiratory infection, they need to be separated from the really young children.
With RSV, doctors say they are working to educate parents on what to look for. Typically, symptoms worsen by day 3 of infection, but a Ballad pediatrician says meeting with a primary care doctor early can prevent an emergency room trip.
I think that's what clogs our emergency rooms is 3 out of 4 visits probably don't need to be there if they just came and saw their doctor.
A tip for parents of young children from Ballad: keep supplies on hand to treat RSV at home. That includes saline and suction devices, as well as acetaminophen and ibuprofen.